Good morning. We're getting ready to start another busy week in the legislature. Reflecting back a little bit, we've got 4 simple plan bills that are now law. We've got another one that's on the governor's desk waiting to be signed. Representative Bell's bill regarding using public funds to support ballot measures. That's House Bill 1187. We also passed a couple of bills related to Medicaid sustainability last week. Representative Josh Miller had a bill that requires drug testing and criminal background checks for certain Medicaid caregivers, and he also passed a bill with huge bipartisan support out of the House to remove the earned income limit on Medicaid eligibility. We've got several tax reform bills that are out there. Charlie Collins has filed bills for income tax reform. Today in Arkansas, our top tax rate is 7%, and that kicks in on earned income above $33,200, which is the highest income tax bracket in the state. People who make that money are paying the same amount as more wealthy people pay, and we believe that rate and that bracket is too high. There's an old adage that the more you tax something, the less you get of it. In Arkansas, we tax jobs more than any states surrounding us, and so we want to reduce that tax rate so that we can do our part into making Arkansas a friendly place for jobs, a friendly place for expansion and growth in the private sector. It costs more to hire a worker in Arkansas than it does in surrounding states, and it gives us a competitive disadvantage in the job market. These bills represent the commitment of House Republicans to turn our state into a good jobs magnet through bold reforms in the tax code. These are reforms that will benefit middle-class Arkansans and families and the private sector job creators who will put Arkansas folks back to work. The Medicaid issue, I believe you'll start to see a lot more movement on that this week. We've got a lot of news regarding Medicaid, both Medicaid reform and the private insurance option. Discussions continue around this private insurance option that started out as an idea of some House and Senate Republicans who made those ideas known, and the governor took them to Washington and found out that we indeed have a lot of flexibility as we work to revise our Medicaid system here in Arkansas. This new option gives legislators the opportunity to craft a conservative market-based approach to Medicaid and to the healthcare system. As of yet, we still do not have all the exact details on what's available to us through the private insurance option, what that will cost, and what the long-term effects will be. So we've got a lot of work and a lot of study to do on this private insurance option, and there are still a lot of questions to be answered. And if we're going to get this done by the 1st or middle of April, we've got to really get a move on it. On Medicaid reform, we continue committed to reforming the existing Medicaid system. Last week we were able to hire the Alexander Group as a consultant to the House and the Senate on the existing Medicaid system. Gary Alexander, who wrote the Global Medicaid Waiver in Rhode Island, is the head of that group. He will be here in Arkansas hopefully tomorrow afternoon, and we'll spend the better part of the week meeting and discussing, gathering data, and getting ready to go back and really put a sharp eye on what we're doing in Medicaid in Arkansas and be able to give us feedback and give us ideas on how to reform the existing system to make it more sustainable. Gary's also well known for the work that he's done to control waste, fraud, and abuse in Medicaid systems, and we're excited for when he gets here and to be able to use his experience and his knowledge to help us with our Medicaid system. And with that, I'll take any questions.
Revenue and tax on the House side hasn't met in over a week. Obviously, the Senate passed a tax bill. Speaker Carter said on Friday that it's going to kind of be held until they figure out what's going to go on. What do you see happening in revenue and tax this week exactly?
I don't see a lot happening in revenue and tax. I believe the revenue and tax issues will be held right till the end of the session. We've still got the Medicaid question to ask, which greatly affects what happens on any kind of tax cuts. You've got the tax cuts that the Senate wants to pass. You've got tax cuts the House wants to pass, and then I remember the number correctly, there's about $2 billion in tax cuts that have been proposed if everybody's tax cut passed. So I think we will wait till the end of the session. We'll find out where we are on Medicaid, and we'll see what kind of tax package we can come out with. But I'm excited that tax package is going to be somewhere in the neighborhood of $100 to $150 million.
And you say we're supposed to learn more about some more stuff about Medicaid. What do you anticipate us learning this week?
Well, I believe more will develop on the private insurance option, exactly what is available to us. There's a plethora of questions that arose when we found out that we could use the private option for those below 138% of poverty level. And there's questions about how that would affect the existing system, how many people you would get crossing over from the existing system into the private insurance. Just a lot of details that have to be worked out and a lot of questions that have to be answered. And we're staying in contact with John Seelig and Andy Allison. They've been very good to work with us and try to gather data and answer any questions that we have.
And you say work with us. Can you describe kind of your direct involvement with this process and how's that been? Have you been directly speaking with the BB administration? Because I know Representative Burris has.
If you're talking about direct involvement, I watched the daylight savings times come into effect Sunday morning while I was reading and making notes on Medicaid issues. But yes, I talk to Director Seelig often. Meet with he and Andy Allison when it's convenient, and they're totally committed. And I think it's the governor's direction to help us in any way they can to gather data and help us get our questions answered so we can address the concerns of Medicaid here in Arkansas.
I mean, here's a Representative Burris, obviously still in kind of the gathering of information, but at the same point he kind of seems like let's maybe build some information to get this maybe passed. Where are you on that? Because I know the session started, you're like, this is not even on the table, possible expansion. Where are you now?
As far as gathering information?
As far as potentially getting a vote, getting 75 votes in the House to expand healthcare coverage.
Well, again, we don't know what the option will be. I'm optimistic that it will be a bold reform rather than an expansion. It'll be a way to maybe move people that are on the existing Medicaid system into the private health insurance option. I believe there are ways we can do this and make it less costly and get better services for those people who are receiving government health assistance right now, and as well as other ones who will be on it in the future.
Right. I mean, y'all have known that for 2 weeks. I mean, now obviously you're down to the details of whatnot, but given that, I mean, do you feel there's kind of getting a push now to get there with those votes, or what do you think that the tone is within the House caucus?
I think everyone's cautiously optimistic. There's been a lot of national attention garnered towards what we're doing with Medicaid here in Arkansas, and that's a little bit strange because nobody here knows exactly what we're doing. We just know we have an option to use a private insurance for those below 138%. I think the real issue when you boil it down is what do those private health insurance plans look like, and do they have a deductible? Do they have or how high is the deductible? Do they have a copay? How much is the premium? How much will the beneficiary be expected to pay the premium? How do you structure those insurance plans? I think there's some creative things we can do there that can provide good assistance to those who are in need of the health care benefits, and do it in a cost-effective, innovative way that saves the state money, and the more people that are on the existing Medicaid system that we could get under this option would be better off down the road.
What's the status of a voter ID bill? It won't come up today. There's some constitutional concerns.
Well, it won't come up today because there won't be any Senate bills run in the House today. But I believe those constitutional concerns have been addressed. I've talked to several attorneys who have looked at that, and I don't see that as an issue. I think we'll go ahead and run it in the House, and hopefully it'll pass. The Senate has passed it on a simple majority vote. I think all it requires a simple majority vote in the House as well.
Can a member move to have it sent back to the Senate, or move to send it to Rules Committee to address those issues?
My understanding is that can happen, but again, that would take a majority vote to make that happen. at least a majority vote. I'm not sure if we'll take it more than a majority. But I don't see it as an issue that we won't address voter ID in the House and pass it and ensure one of the most precious rights that we have is the right to vote and protect that. And I believe that's something that the people of Arkansas want to see, and we'll pass it when it comes along.
Do you think you still have the votes to pass it with a simple majority, or are these only Democrats' concerns or Republicans?
I'm not sure how much bipartisan support there is for voter ID. I would expect that there is some bipartisan support for that, but it's razor thin margins when you start looking at R's and D's in the House. So sometimes you don't know until you vote.
When do you see it coming up?
I would think tomorrow.
We have a fairly long House agenda even without Senate bills today. Do you think there's anything on there that could be close at all?
Well, it's always surprising sometimes, but I don't see anything on here that's too controversial without voter ID on it today.
So voter ID won't come up today.
No, there won't be any Senate bills that will come up today, any House bills.
There's that recent Washington Post article that quoted somebody from the Health and Human Services saying that they're talking to you guys. Of course, they gave you guys the private option, for expanding health coverage, but they're waiting on a concrete proposal from you guys. So are you guys working on a concrete proposal written, I guess, to see if they can see it?
Yeah, and that's I spent a lot of time over the weekend making notes and reading as much information as I could have and getting my ideas down on paper so that I can share with others on what that concrete proposal is.
So I guess, are you writing it, or is
I think it'll be a joint effort there with the Senate and the members of the House. Obviously, Representative Burris, Senator Bledsoe with the Public Health Committees, Senator Sanders, and Dismay and I have all been working on it all along. So, and then there are several other members I know in the House that are looking at different Medicaid ideas. I'll be anxious to see how many Medicaid bills are filed Friday and today, but I know I've heard a lot of ideas out there and things we can do for Medicaid.
What do you think about the amount of legislation filed this session? Obviously, today's the deadline, and there's stacks and stacks of envelopes, kind of almost stacks in the roof here. It sounds like it's going to be a record year. What are your thoughts on the amount of legislation?
I know personally I've filed more shell bills than I've ever filed, and a lot of that's because of the direction that we may go with Medicaid, and just making sure that we've got the framework of the bill out there if we need it as we move forward. As I said, today's the last day, so if you don't have a bill in the hopper, you can get left out if there's an idea you had, one that comes up after today.
Thanks.
All right.